Hello English learners. How are you? I hope you're all doing really well. A big warm welcome to Progressive English Learning. Always remember, learning English is not just about grammar or vocabulary, it's about confidence and communication. Every time you practice, you're one step closer to fluency. So never give up, stay focused, stay motivated, and keep growing. Before we continue, don't forget to subscribe to my channel Progressive English Learning so you never miss a new lesson. And of course, drop your thoughts in the comments below. Now, in today's lesson, we'll be practicing a very important and useful topic, health and doctor visits. Here you'll learn conversations about describing symptoms, making doctor's appointments, talking about medicines, and receiving advice. These dialogues will help you communicate clearly and confidently whenever you visit a doctor or a clinic. So let's begin this practical lesson and improve together. It started with a slight headache that lingered through the morning, making him feel tired and a bit dizzy as he tried to focus on his daily activities. He noticed a mild fever and a sore throat by the afternoon, so he decided to call the local clinic to make an appointment with the doctor. When he arrived at the clinic, the nurse took his temperature and asked him about his symptoms, noting down the details before the doctor came in. The doctor asked questions about his medical history and recent habits, then performed a quick examination of his throat and ears. After the physical checkup, the doctor suggested some blood and urine tests to understand if there was any infection or other issues. The nurse helped him fill out the forms for the tests and explained how to prepare for them, including fasting for a few hours before the blood draw. He waited patiently in the waiting room until a technician called him in for the tests, which were quick but made him a little nervous. After the tests, he returned home with the doctor's advice to rest and stay hydrated, while waiting for the results to come by the next day. When the call finally came with the test results, the doctor calmly explained that there was a mild infection and prescribed antibiotics along with pain relievers. The doctor carefully instructed him on the medicine dosage, the times to take the pills, and emphasized the importance of completing the full course to prevent the infection from returning. He was also advised to avoid heavy meals and sugary drinks during this period to help his body heal more easily. Following the advice, he went to the nearby pharmacy to get the medicines, where the pharmacist checked the prescription and explained possible side effects and interactions with other medications. At home, he made sure to keep the medicines in a cool place and set reminders on his phone to take them on time. Over the next few days, he observed improvement in his symptoms, feeling less feverish and the sore throat gradually easing. Still, the doctor had scheduled a follow-up appointment to monitor his progress and ensure the infection was completely gone. Meanwhile, he kept a health diary, noting down any changes or new symptoms to report during the next visit. When the day of the follow-up came, the doctor reviewed the diary and asked if he had experienced any side effects or problems taking the medication. Seeing his good recovery, the doctor gave tips on maintaining a healthy lifestyle, such as eating balanced meals rich in fruits and vegetables, sleeping at least 8 hours every night, and doing light exercises to boost the immune system. The doctor also suggested reducing stress by practicing relaxation techniques like deep breathing or meditation. He discussed the importance of avoiding smoking and limiting alcohol consumption to keep his body strong against illnesses. Before leaving the clinic, they talked about health insurance options to cover future medical expenses and how to check the details online or speak with an insurance agent. On his way back, he reflected on how important it was to listen to his body and seek medical help early rather than ignoring symptoms. Feeling better than before, he He promised himself to take more care, going for regular checkups and not delaying treatments even when the signs were mild. This experience taught him that health is a treasure worth protecting through proper habits, timely doctor visits, and following medical advice carefully. A few weeks later, he began to notice occasional stomach discomfort after meals, with a slight bloating that made him uneasy, so he decided to visit the doctor again to discuss his concerns. During the appointment, the doctor asked about his diet and eating habits, suggesting he keep a food diary to track which foods might be causing the discomfort. The doctor also recommended some basic tests, including an ultrasound and blood work, to rule out any digestive issues or allergies. After the tests were done, he waited for the results while trying to eat smaller portions and avoid spicy or greasy foods as a precaution. When the results arrived, the doctor explained that everything appeared normal but suggested trying probiotics and a gentle antacid to help soothe his stomach. The doctor also advised drinking plenty of water and eating more fiber-rich foods like whole grains and vegetables to improve digestion. He was told to avoid late-night meals and to eat slowly, chewing food well to help with digestion. The doctor checked on his current medications to ensure there were no negative interactions with the new recommendations. With the new advice in mind, he went to the pharmacy to buy the probiotics and antacid, where the pharmacist gave instructions on taking them properly and warned about not exceeding the recommended dosage. At home, he made changes to his eating schedule, choosing lighter meals and incorporating more fresh fruits and salads as part of his daily routine. After about 10 days, he felt a noticeable improvement, with less bloating and discomfort after meals. The doctor suggested maintaining these healthy eating habits and scheduling another checkup in a month to monitor the progress. During the follow-up visit, they talked about possible stress-related triggers and ways to manage stress through regular physical activity, such as walking or yoga, which could also help digestive health. The doctor encouraged him to avoid skipping meals. Drink herbal teas known for calming the stomach, and continue with the supplements as long as they seemed to be effective. This experience helped him understand how lifestyle choices, such as diet and stress management, play a crucial role in overall health and how paying attention to small symptoms can prevent bigger problems later. He felt more confident about taking control of his health by combining medical advice with practical changes in daily life routines. Over the following weeks, he also began paying closer attention to his physical condition, recognizing that exercise could be a key factor in improving both his digestion and his general well-being. He started going for daily walks in the nearby park, enjoying the fresh air and gentle movement, which helped relieve tension and improved his sleep quality. Noticing the positive changes, he gradually added light stretching and beginner yoga poses to his routine, following simple videos recommended by the doctor. Meanwhile, he checked in regularly with the doctor, reporting that the stomach discomfort was nearly gone and that he felt more energetic overall. The doctor praised his efforts and encouraged him to keep up with the exercise, also suggesting periodic blood pressure and cholesterol checks to monitor cardiovascular health as part of his overall checkup plan. When the results showed good progress, the doctor explained how the combination of regular physical activity, balanced nutrition, and proper rest contributed significantly to preventing chronic diseases in the long term. This motivated him to stay committed, even on days when he felt tired or busy, reminding himself that health maintenance was a daily responsibility. Each visit to the clinic also included simple screenings for vision and hearing, and the doctor advised scheduling dental checkups, focusing on comprehensive health care rather than addressing problems only when they became severe. He purchased a reliable blood pressure monitor for use at home, as per the doctor's advice, and learned how to keep a health journal documenting daily blood pressure readings, mood, sleep hours, and diet quality. At home, he prepared meals with fresh ingredients, trying to reduce salt and sugar content following the doctor's dietary recommendations. He experimented with herbs and spices such as ginger, turmeric, and garlic, known for their anti-inflammatory properties and potential benefits in boosting immunity. After a few months, he visited the clinic for a complete health checkup, where the doctor conducted a thorough physical examination and reviewed his health journal in detail. The doctor offered personalized advice on how to manage occasional stress through mindfulness techniques and encouraged social activities to maintain mental health. He also addressed the importance of vaccinations, updating him on seasonal flu shots and other immunizations relevant to his age and health status. The doctor emphasized that keeping up with vaccinations was a critical and often overlooked part of preventive health care. Feeling more informed, he made an appointment at the local pharmacy to schedule his flu vaccine, where the pharmacist confirmed the vaccination dates and checked his medical history for any prior allergies or reactions. The vaccination process was straightforward and painless, with clear post-vaccination care instructions provided, including signs to watch for and when to seek medical advice if needed. Over time, he became more proactive about recognizing early symptoms of illness, such as slight coughs, changes in appetite, and fatigue, acting quickly by consulting medical professionals rather than delaying care. His confidence grew as he learned how to communicate symptoms clearly during doctor visits, ensuring accurate diagnoses and appropriate treatment plans. Alongside physical health, the doctor stressed the connection between mental and emotional well-being and physical symptoms, advising simple daily practices like journaling and speaking with trusted friends or counselors when feeling overwhelmed. He practiced some of these strategies, which helped reduce feelings of anxiety and improved his ability to handle stressful situations with calmness and clarity. In addition to following medical advice, he researched reputable health websites recommended by the clinic, gaining knowledge about common illnesses, medicines, and healthy habits. This empowered him to make informed decisions and avoid unnecessary panic when facing minor health issues. One day, a friend mentioned a sudden allergic reaction to a new medication, reminding him to always check with his doctor or pharmacist about possible allergies before starting any new treatment. He kept a list of his known allergies and current medications in his wallet, ready to share with any healthcare provider in emergencies. When traveling for work or leisure, he made sure to carry a small first aid kit and sufficient medicine supplies, including pain relievers, antiseptic creams, and antihistamines, to handle minor health problems away from home. On longer trips, he researched nearby hospitals or clinics and their emergency services to be better prepared in case urgent care was needed. His improved health literacy helped reduce anxiety about illness and treatment, allowing him to enjoy everyday activities with more peace of mind. At the clinic, he sometimes requested printed summaries of his visits and test results, which were useful for tracking his health progress and sharing information with new doctors if he moved or changed primary care providers. The medical staff appreciated his active involvement in managing his health, which fostered better communication and personalized care plans. Once, during a routine checkup, the doctor noticed a small but unusual skin lesion and recommended seeing a dermatologist for a closer examination. This preventative approach reassured him, highlighting the importance of regular screenings beyond basic symptoms. The dermatologist confirmed it was benign but demonstrated how to perform monthly self-examinations to detect any changes early. This experience taught him to be observant about his body and seek timely professional opinions on any unusual signs. When discussing lifestyle adjustments, the doctor emphasized enough hydration, pointing out that drinking water regularly throughout the day helped not only physical health but also concentration and mood. He made a habit of carrying a reusable water bottle, setting reminders if he forgot to drink enough, which made a noticeable difference in his energy levels. Sleep hygiene was another topic addressed. The doctor advised keeping a consistent sleep schedule, avoiding screens before bedtime, and creating a calm environment in the bedroom for quality rest. He implemented these tips and found his sleep improved, leaving him more refreshed and less prone to irritability. At the pharmacy, he also explored over-the-counter options for vitamins and supplements, with the pharmacist's guidance ensuring he chose appropriate products without risking overdoses or harmful interactions. She explained that while supplements could support health, they should never replace balanced nutrition but rather complement a wholesome diet. Meanwhile, he began to pay attention to his posture during work, especially since many hours were spent sitting at a desk. Simple ergonomic changes, such as adjusting chair height and taking short breaks to stretch, helped reduce back and neck pain. He asked the doctor for exercises specifically designed to improve core strength, which was recommended to prevent future issues. Feeling empowered by this knowledge, he shared some tips with his colleagues, encouraging a healthier work environment and mutual support for physical well-being. The doctor also discussed ways to control weight through gradual, realistic changes instead of drastic dieting, focusing on sustainable habits that he could maintain long-term without feeling deprived. These included portion control, mindful eating, and incorporating more physical activities he enjoyed, rather than rigid workout plans. Through this multifaceted approach combining medical care, healthy habits, and personal responsibility, he experienced not only better physical health but also growing confidence and peace of mind in managing his body and mind. One morning, he woke up feeling unusually tired and noticed a mild cough that seemed to worsen throughout the day. Remembering his previous experiences, he decided not to ignore these symptoms and scheduled a doctor's appointment promptly rather than waiting for the condition to worsen. At the clinic, the doctor examined him carefully, asking about any other symptoms such as shortness of breath, chest pain, or fever. The doctor performed a stethoscope exam to listen to his lungs and suggested a chest X-ray to rule out any serious infections like pneumonia. While waiting for the X-ray results, the doctor advised rest, plenty of fluids, and suggested over-the-counter cough suppressants to ease his symptoms temporarily. When the test results returned normal, the doctor diagnosed him with a simple viral infection and reassured him that it would clear with rest and proper care. The doctor emphasized avoiding antibiotics unless specifically needed to prevent antibiotic resistance, and encouraged him to maintain good hand hygiene to avoid spreading the virus to others. Taking the prescribed advice seriously, he infused his routine with healthy meals, including warm teas with honey and ginger to soothe his throat. He also avoided smoking areas and crowded places to reduce exposure to additional germs while his immune system worked to heal his body. He tracked his symptoms daily, noting improvements and any new signs to communicate during follow-up calls. After a week, the cough lessened, and his energy returned, but the doctor suggested completing the follow-up to ensure full recovery and to discuss preventive measures for future colds. During the follow-up, the doctor reviewed his symptom diary and praised his attention to detail, noting this helped to tailor the advice better. They talked about boosting immunity naturally through a balanced diet rich in vitamins C and D, found in citrus fruits, leafy greens, and fortified dairy products. The doctor recommended regular moderate exercise as a natural way to support immune function and overall well-being. Realizing the importance of these habits, he integrated them consistently into his lifestyle, feeling more prepared to face seasonal illnesses. Apart from physical health, the doctor discussed the significance of mental wellness, particularly during longer illness periods, advising him to stay socially connected and seek support when feeling isolated. He took this advice to heart, making a plan to visit friends and engage in community activities as his strength returned. On another occasion, he encountered mild joint pain, especially in his knees after walking or climbing stairs, which prompted another visit to the clinic. The doctor conducted a physical examination, testing the range of motion and checking for swelling or tenderness in the joints. An X-ray was ordered to look for any damage or signs of arthritis, and lab tests checked for inflammation markers. While waiting for results, the doctor recommended rest, applying ice packs to reduce swelling, and taking over-the-counter pain relief as needed. The doctor also suggested gentle exercises to maintain flexibility and strength without straining the joints. When the results showed early-stage arthritis, the doctor explained the condition carefully, reassuring him that with proper management, progression could be slowed and symptoms well controlled. The doctor emphasized weight management as crucial in reducing joint stress, so he worked with a nutritionist to create an anti-inflammatory diet plan including omega-3 fatty acids found in fish and nuts. Physical therapy sessions were prescribed to teach him exercises that strengthened muscles supporting the joints and improved mobility. Additionally, the doctor advised punctual medication intake and regular follow-up appointments to monitor inflammation and adjust treatment if necessary. During the pharmacy visits for prescribed medications, the pharmacist reviewed each drug's usage, possible side effects like stomach upset, and the importance of not skipping doses. He was advised to report any unusual symptoms immediately, such as rashes, difficulty breathing, or persistent nausea. At home, he set up a daily checklist to ensure adherence to medication schedules and exercise plans. His family supported him by encouraging healthy activities and reminding him to attend therapy sessions, which made sticking to the routine easier. In time, the joint pain decreased noticeably, improving his quality of life and allowing him to enjoy daily walks without discomfort. This experience deepened his appreciation for proactive health monitoring and comprehensive care involving both medical professionals and personal commitment. He also became more open to sharing his story with colleagues and friends, highlighting the benefits of early diagnosis and lifestyle changes for chronic conditions. This openness helped reduce stigma around joint problems and encouraged others to seek help sooner. Meanwhile, his awareness of health insurance details increased as he worked with his insurer to find plans covering physical therapy and specialty medications. He learned to navigate claim submissions and understood the importance of keeping all medical receipts and documents organized for efficient reimbursement. The doctor's office staff assisted with paperwork when needed, explaining complex forms and guiding him through authorization processes. Another key lesson was the importance of vaccination beyond flu shots. The doctor advised him to get the shingles vaccine as he was approaching the recommended age range. He scheduled this at the pharmacy, where the pharmacist confirmed vaccine availability and possible side effects such as redness or mild fever post-injection, which were normal signs the body was building protection. Regular dental visits also became part of his health routine after the doctor highlighted the connection between oral health and systemic diseases like heart problems and diabetes. The dentist checked for cavities, gum disease, and recommended proper brushing and flossing techniques to prevent infections. He invested in quality dental hygiene products and maintained consistent visits every 6 months. In conversations with healthcare providers, he became more confident asking questions about symptoms, medications, and recommended lifestyle tips. This helped avoid misunderstandings and ensured treatments aligned well with his preferences and daily schedule. The doctor suggested keeping a personal health file containing all medical records, test results, and vaccination history to share easily with any new healthcare provider. Feeling empowered, he took control of his health journey by scheduling routine screenings such as blood sugar, cholesterol, and cancer screenings based on family history and doctor recommendations. Preventive health became a priority, supported by ongoing education from credible sources and professional guidance. He also learned to identify red flags, such as sudden severe headaches, unexplained weight loss, or persistent chest pain, that require immediate medical attention. When these signs appeared in friends or family, he encouraged timely doctor visits to prevent complications. His commitment extended to mental health, where he practiced stress reduction techniques and balanced work-life responsibilities to maintain emotional well-being. The doctor advised occasional mental health screenings, which he incorporated at annual checkups, finding these sessions helpful in recognizing mild anxiety symptoms early and seeking counseling before issues grew serious. Throughout this process, he understood that health is a lifelong journey demanding awareness, patience, and cooperation between patient and healthcare providers to achieve the best outcomes. This evolving relationship with medicine taught him valuable skills in communication, self-monitoring, and adapting lifestyle habits to support a strong body and mind. The experience transformed not only his approach to sickness but also his appreciation for wellness, prevention, and resilience, inspiring him to share this knowledge with others to improve collective health in his community. After embracing the changes for managing his joint pain, he noticed that maintaining good health required constant attention to detail and timely action. One day, he experienced an unexpected dizzy spell after standing up too quickly, which worried him enough to call his doctor for advice. The doctor explained that sudden dizziness might be caused by low blood pressure or dehydration, common issues but important to monitor. He was instructed to drink more fluids, avoid sudden movements, and keep a daily log of symptoms including dizziness, fatigue, and any visual disturbances. The doctor scheduled blood tests to check for anemia or electrolyte imbalances that could contribute to these episodes. Meanwhile, he practiced standing up slowly from sitting or lying positions and made an effort to stay hydrated throughout the day, carrying a water bottle everywhere. The lab results showed mild anemia, possibly due to nutritional deficiencies, so the doctor recommended iron-rich foods such as spinach, beans, and lean meats, along with a prescribed iron supplement. The doctor carefully explained how to take the iron pills to minimize stomach upset, such as with vitamin C-rich juice for better absorption and avoiding taking them with calcium-rich foods. He was advised to continue monitoring his symptoms and return for a follow-up in a month to check if the anemia had improved. The pharmacist provided guidance on the supplement as well, warning about potential constipation and the importance of not exceeding the recommended dose. Through these steps, he learned the importance of addressing even small health changes promptly, understanding how interconnected the body's systems are. Incrementally, he began to feel steadier and more energetic, appreciating the warm support from family who helped remind him to stick to new routines. At the scheduled follow-up, the doctor reviewed the progress, noting a positive response to the iron therapy and improved blood pressure readings. The doctor encouraged continuing the balanced diet and hydration habits, also warning about the dangers of quick fixes or missing medications. They discussed sleep patterns again, as poor rest can affect blood pressure and anemia symptoms. He shared that he was sleeping better after eliminating caffeine late in the day and establishing a nightly routine that helped him relax before bed. Inspired by the progress, he proactively sought advice about vitamins and minerals to supplement his diet without overdoing any one element. The pharmacist explained the benefits of a multivitamin but reminded him that whole foods remained the best source of nutrients. They discussed the role of fiber to promote digestive health, which in turn could aid nutrient absorption and prevent constipation from supplements. On another note, he encountered a minor allergic reaction when trying a new laundry detergent that caused skin redness and itching around his wrists. Recalling his doctor's earlier advice on allergies, he applied a gentle moisturizer and avoided scratching, then contacted the clinic to report the symptoms. The nurse guided him on basic allergy care and booked an appointment with an allergist for further evaluation. At the allergy clinic, skin testing helped identify the specific chemicals causing the reaction, allowing him to switch to hypoallergenic products safely. The allergist also provided tips on managing future reactions, including how and when to use antihistamines and mild topical steroids if necessary. This experience reinforced the importance of identifying triggers to avoid repeated problems and seeking specialized care when needed. He documented the allergy details carefully and informed his family and workplace to prevent exposure. Beyond physical symptoms, he became aware of the impact of seasonal changes on his overall health and mood. The doctor discussed the benefits of maintaining regular outdoor activity even during colder months to support vitamin D levels and mental well-being. They planned vaccination schedules for pneumococcal and other relevant vaccines to protect him against common respiratory infections. He took interest in understanding blood sugar levels due to family history of diabetes, so the doctor ordered fasting glucose and HbA1c tests during a routine visit. When results indicated prediabetes, the doctor emphasized lifestyle modifications such as increased exercise, weight management, and healthier food choices to prevent progression to diabetes. He worked with a nutritionist to develop meal plans focusing on low glycemic index foods, whole grains, and lean proteins, while reducing processed sugars and saturated fats. Regular physical activity was encouraged, with specific recommendations to include both aerobic and resistance exercises. He tracked blood sugar at home using a glucometer, learning normal ranges and when to seek medical advice. Through this process, he realized the critical role of self-monitoring and early intervention in managing chronic conditions. At every appointment, the doctor reinforced the value of mental health, addressing concerns about anxiety related to these new health challenges. He learned relaxation techniques, including guided imagery and controlled breathing, which helped reduce stress levels significantly. To maintain motivation, he joined a support group for people managing prediabetes, sharing experiences and tips that fostered a sense of community and accountability. This holistic approach to healthcare, combining medical support, self-care, and social connections, profoundly improved his quality of life. He developed a detailed health schedule including medical appointments, health screenings, medication reminders, and fitness sessions, which helped him stay organized and compliant with medical advice. Access to health information was improved through digital tools recommended by his healthcare providers, such as apps for medication tracking and Symptom logging. He also maintained a notebook of questions to prepare before visits, ensuring discussions were productive and tailored to his concerns. When experiencing occasional chest tightness during exercise, he promptly informed the doctor, who arranged an electrocardiogram, ECG, and a stress test to evaluate heart function. The tests showed minor irregularities but no immediate danger, prompting lifestyle advice focused on heart health. These included lowering salt intake, avoiding excessive caffeine, managing stress, and continuing physical activity within comfortable limits. The doctor scheduled regular cardiac checkups to monitor his condition, reassuring him that consistent follow-up was key to prevention. He adapted his routines accordingly, avoiding strenuous workouts until cleared and focusing on gentle activities such as swimming and walking. Dietary changes included incorporating foods rich in potassium, like bananas and sweet potatoes, which support healthy blood pressure levels. He learned to read nutrition labels carefully to limit foods high in sodium and unhealthy fats. To handle occasional flare-ups of mild acid reflux, he adjusted meal timings and avoided trigger foods like chocolate, caffeine, and fatty meals. The doctor provided guidance on using antacids or acid reducers safely and knowing when symptoms require urgent care. At work, he discussed with his employer the need for occasional breaks to manage health conditions, leading to flexible arrangements that reduced physical stress and boosted productivity. The employer appreciated his openness and commitment, creating an environment that promoted well-being among all staff. Throughout these experiences, he realized how important it was to view health as a dynamic process rather than a static state, requiring continual attention and adaptation. Regular communication with his healthcare team, along with family support, fostered confidence to make informed decisions and avoid unnecessary worry. He came to appreciate the value of prevention, including adopting vaccinations, balanced nutrition, physical activity, and stress management, as the foundation for long-term health. This journey transformed his approach to doctor visits from a reactive chore into a partnership focused on achieving the best possible outcomes. Encouraged by this progress, he also began participating in community health programs, attending seminars on nutrition, exercise, and chronic disease awareness. These events provided additional motivation and practical knowledge while expanding his social network. He volunteered at health fairs, helping spread awareness about the importance of regular checkups and healthy living. His story inspired others to prioritize their health and seek timely medical advice, helping create a culture of wellness in his local area. As his health stabilized, his goals shifted toward maintaining vitality, managing minor ailments independently when appropriate, and recognizing when professional care was necessary. Over time, he embraced a balanced life where medical advice, healthy habits, and emotional well-being worked together to support a fulfilling lifestyle free from preventable illness. As seasons changed, he made it a habit to keep track of any new symptoms carefully, knowing that timely action was crucial. One winter morning, he noticed a persistent cough accompanied by mild chest discomfort and decided not to delay another doctor visit. The physician performed a thorough examination, listened carefully to his lungs, and ordered a sputum test along with a chest X-ray to rule out infections such as bronchitis or pneumonia. The doctor advised him to rest and prescribed cough syrup along with medication to reduce inflammation. Meanwhile, he was cautioned to monitor his temperature closely and return immediately if symptoms worsened or breathing became difficult. During this period, he kept a daily symptom record, tracking fever, cough severity, and energy levels, which helped his doctor adjust the treatment according to his progress. After a week, the test results indicated a mild bacterial bronchitis, so the doctor prescribed a course of antibiotics, emphasizing the importance of completing all doses even if symptoms improved quickly. The pharmacist reinforced this message, explaining how incomplete antibiotic use could lead to resistant bacteria and future treatment failures. He followed the medicine schedule diligently, using a pill organizer to avoid missing doses. Along with medication, he maintained hydration, avoided irritants like smoke, and used a humidifier overnight to ease breathing. After finishing the antibiotics, the doctor scheduled a follow-up to ensure the infection had fully cleared. This visit included a lung function test that confirmed his breathing was back to normal. The doctor praised his cooperation and reminded him that early care and adherence to treatment were vital to health recovery. Around the same time, he developed mild allergic rhinitis, triggered by dust and seasonal pollen, causing sneezing, runny nose, and itchy eyes. The doctor prescribed antihistamines and nasal sprays and recommended keeping windows closed during high pollen days and using air purifiers indoors. He read instructions carefully to avoid overusing nasal sprays, which could cause rebound congestion. He also tried saline nasal rinses to soothe irritation naturally. This experience taught him to recognize environmental triggers and manage symptoms proactively through both lifestyle changes and medication. To improve his lung health, the doctor encouraged quitting smoking, if applicable, and maintaining regular moderate exercise such as swimming and walking, which help clear airways and support cardiovascular fitness. He kept track of his physical activity on a weekly calendar, setting realistic goals and gradually increasing intensity based on comfort and endurance. The healthcare team advised vaccinations for pneumonia and COVID-19 to protect him against respiratory infections, which he promptly received at the pharmacy. The pharmacist explained the vaccine types, common side effects, and post-vaccination care, reassuring him about safety and effectiveness. Through these measures, he gained confidence in preventive health and the benefits of immunization. As he continued managing his respiratory health, he also remained attentive to overall wellness, scheduling annual physical exams that included checks for blood pressure, cholesterol, and blood sugar levels. The doctor reviewed his family history and lifestyle factors to personalize screening recommendations, explaining the rationale behind timing and test choices. When blood tests showed slightly elevated cholesterol, he worked with a dietitian to adjust his nutrition. They focused on reducing saturated fats and increasing fiber intake by eating more oats, fruits, and vegetables. Incorporating healthy fats such as olive oil and fatty fish was also part of the plan to improve lipid profiles naturally. Physical activity was increased to at least 150 minutes a week, combining walking with strength training to optimize heart health. He monitored cholesterol levels regularly with his doctor, appreciating the gradual improvements and avoiding medication unless absolutely necessary. This experience reinforced the power of lifestyle changes over medication in some cases. Along with physical health, mental health remained a priority, especially during stressful times at work and in personal life. The doctor suggested mindfulness practices and keeping a stress journal to identify triggers and coping strategies. He tried short meditation sessions each morning and progressive muscle relaxation exercises before bed to ease anxiety and improve sleep quality. Talking openly with friends and family about his feelings helped reduce loneliness and build emotional resilience. The doctor recommended seeking professional counseling if stress or mood changes became severe or persistent, normalizing mental health care as part of overall wellness. He scheduled regular breaks from work, even brief walks outside during the day to refresh his mind and body. This balance between work, rest, and social connection improved his mood and productivity. When he noticed occasional heart palpitations during exercise, he informed his doctor immediately, who conducted an electrocardiogram and monitored his heart rhythm over 24 hours using a Holter monitor. The tests showed harmless ectopic beats, common and usually benign, but the doctor explained when to seek emergency care if symptoms worsened. They recommended stress reduction and avoiding stimulants such as excessive caffeine. He adjusted his routines accordingly and continued regular cardiovascular checkups. The healthcare team also stressed the importance of good sleep hygiene for heart health, encouraging regular sleep times and avoiding screens before bedtime. He followed these tips and found improvement in energy and reduced palpitations. During dental checkups, he learned how oral health affected cardiovascular risks and diabetes control, motivating rigorous daily brushing, flossing, and routine professional cleanings. He replaced sugary snacks with healthier alternatives like nuts and fruits to protect teeth and overall health. The doctor and dentist collaborated on his care, demonstrating the benefits of coordinated health management across specialties. On trips, he always carried a basic first aid kit and essential medications, including allergy pills and pain relievers, planning ahead for health needs. Researching local medical facilities before travel gave him peace of mind in case emergencies arose. He kept digital copies of his medical records and insurance details accessible on his phone. His health insurance plan covered preventive services, hospitalizations, and medications, but he reviewed coverage annually to ensure it met his evolving needs. He learned how to file claims, submit required documents, and appeal denials if necessary. Staff at the insurance office helped clarify benefits and assist with paperwork, making the process smoother. Managing finances around healthcare became easier with this knowledge, reducing stress related to unexpected bills. Nutrition remained a cornerstone of his health strategy, with meals rich in whole foods, balanced carbohydrates, lean proteins, and healthy fats. He adopted habits such as cooking at home more often and limiting processed foods high in salt and sugar. Meal planning helped him avoid impulse buys and ensured he met daily nutrient goals. He incorporated seasonal fruits and vegetables, exploring recipes that combined taste and nutrition. Hydration was simplified by carrying a water bottle and setting reminders. Limiting caffeine and alcohol intake further supported his health goals. Regular physical activity was maintained through varied exercises to prevent boredom and address different muscle groups. He joined community fitness classes and enjoyed group activities that combined social interaction with movement. This engagement fostered motivation and consistency. The doctor advised avoiding overexertion and listening to his body signals, adjusting intensity when feeling tired or unwell. Warm-up and cool-down routines were added to prevent injuries. Sleep hygiene was optimized with a dark, quiet, and cool sleeping environment, avoiding heavy meals close to bedtime. He kept electronic devices out of the bedroom and read relaxing books before sleep. Tracking sleep quality with a wearable device provided feedback that helped fine-tune habits. Stress management included hobbies, time with loved ones, and occasional breaks from technology. Practicing gratitude journaling improved mood and perspective. He also learned the value of saying no to reduce overload and set boundaries in work and social life. As part of ongoing health monitoring, he kept an updated list of medications, dosages, and allergies to share with any health provider. Routine vaccinations were kept current, including tetanus boosters and travel-related immunizations. The importance of sunscreen to protect skin from harmful UV rays was emphasized by doctors, and he adopted daily use, even when indoors near windows. Regular skin checks helped him observe any new or changing moles or spots, reporting concerns promptly to his doctor or dermatologist. Flu season prompted annual immunization and heightened hygiene awareness. He washed hands frequently, used hand sanitizer in public places, and avoided close contact with sick individuals. Family members followed similar precautions for collective safety. Education about common illnesses and appropriate responses deepened his understanding and empowered self-care. He recognized when over-the-counter remedies were suitable and when to seek professional evaluation. Mental well-being was sustained through social networks, volunteer work, and activities that brought joy and purpose. Over the years, he built a comprehensive health philosophy embracing prevention, early intervention, lifestyle balance, and professional partnership. This journey underscored the profound connection between body, mind, and environment, inspiring lifelong commitment to wellness. One day, as part of his lifelong commitment to health, he felt a mild but persistent stomach ache that lasted several days and decided to schedule a doctor's appointment to explore the cause further. During the visit, the doctor asked detailed questions about his diet, stress levels, recent travel, and any other symptoms such as nausea, vomiting, or changes in bowel habits. The doctor suggested an abdominal ultrasound to check for any abnormalities in his organs and ordered blood tests for infections, liver function, and markers of inflammation. The doctor explained that the symptoms might be due to gastritis, an inflammation of the stomach lining, or stress-related digestive issues, and advised avoiding spicy foods, caffeine, and alcohol in the meantime. The clinic nurse gave him instructions on how to prepare for the ultrasound, including fasting for several hours beforehand to get clear images. After the tests, he waited patiently for the results, continuing to eat bland, easily digestible foods like rice, bananas, and boiled vegetables. When he returned, the doctor reviewed the ultrasound and blood test findings, indicating mild gastritis with no serious complications. To treat it, the doctor prescribed medications to reduce stomach acid, protect the stomach lining, and recommended lifestyle changes such as managing stress through relaxation techniques and regular physical activity. The doctor also advised avoiding taking painkillers like ibuprofen, which could worsen stomach irritation, and to eat smaller frequent meals rather than large heavy ones. He was informed about possible side effects of the medications and the importance of following the dosage instructions carefully to avoid complications. At the pharmacy, the pharmacist confirmed the treatment plan, providing detailed explanations about how and when to take the medicines and offering tips on minimizing side effects such as nausea or constipation. He set up reminders for medication times and kept a daily symptom diary to observe any improvements or side effects. Following the medical advice, he practiced deep breathing exercises daily and incorporated a gentle yoga routine designed to reduce stress without straining his body. Over several weeks, the stomach pain gradually diminished, and his digestion improved significantly. During follow-up visits, the doctor praised his adherence to treatment and lifestyle changes, encouraging him to continue with the healthy habits. The doctor stressed the importance of regular checkups and being vigilant about new or unusual symptoms that might require prompt medical attention. Meanwhile, he took care to avoid excessive alcohol consumption and adopted mindfulness practices to cope better with work and personal pressures. He realized that stress contributed to physical symptoms and that managing mental health was just as important as physical treatment. His proactive approach extended to oral health, where he scheduled regular dental cleanings and paid closer attention to dental hygiene routines to prevent gum disease, which the doctor explained could affect heart health and diabetes risk. He educated himself on how smoking and poor nutrition could exacerbate oral problems and worked hard to avoid these risk factors. During a visit to the dentist, he learned about the significance of flossing properly and using fluoride toothpaste, which helped strengthen tooth enamel and prevent cavities. The dentist recommended cutting down on sugary snacks and drinks, emphasizing balanced nutritional habits for teeth and overall well-being. This comprehensive approach across different medical specialties reinforced his understanding that all aspects of health are interconnected. One summer, during routine health screening, he found out he had slightly elevated blood pressure, a sign that he needed to make some adjustments to his lifestyle. The doctor explained that high blood pressure often has no visible symptoms but could increase the risk of heart disease and stroke if not controlled. He was advised to monitor his blood pressure regularly, reduce sodium intake by limiting processed foods, and increase physical activity further. The doctor suggested adopting the DASH diet, dietary approaches to stop hypertension, which emphasizes fruits, vegetables, whole grains, and low-fat dairy products. He worked with a nutritionist who helped him plan meals that were tasty yet low in salt and unhealthy fats. He also committed to quitting smoking completely, as the doctor emphasized the harmful effects of tobacco on blood pressure and cardiovascular health. Support groups and counseling were offered to aid smoking cessation, which he found motivating and helpful. Regular aerobic exercises such as brisk walking and cycling became a fixture in his daily routine, improving his physical condition and helping lower blood pressure naturally. A fitness tracker helped him monitor activity levels, set achievable goals, and stay motivated. The doctor also monitored his blood pressure medication needs carefully, prescribing medication only if lifestyle interventions were insufficient after a trial period. With consistent effort, his blood pressure gradually normalized, reflecting the powerful impact of healthy behaviors. To stay informed, he read recommended health articles and attended community workshops on heart health that offered practical advice and answers to common questions. These sessions increased his confidence in managing risk factors and recognizing warning signs of cardiac events, empowering him to act quickly if needed. When experiencing occasional fatigue, he made sure to check iron levels, thyroid function, and vitamin B12 during routine blood tests to rule out common causes like anemia or hyperthyroidism. These simple screenings ensured early detection and management before symptoms could worsen. For any new medication prescribed, he discussed possible interactions with his pharmacist. Learning that some drugs could affect nutrient absorption or cause side effects that mimicked illness symptoms. This awareness helped him avoid adverse effects and maximize therapeutic benefits. During the cold winter months, he took special care to maintain warmth and immunity by dressing in layers, eating nutrient-dense soups and stews, and ensuring adequate vitamin supplementation as recommended by his doctor. The doctor suggested checking vitamin D levels, since reduced sun exposure during winter could cause deficiencies impacting bone and immune health. After testing confirmed low vitamin D, He started supplements and monitored levels periodically to achieve optimal balance. These preventive strategies decreased his frequency of colds and flu. In addition, he became competent in recognizing symptoms requiring emergency care, such as chest pain, shortness of breath, or severe allergic reactions, and knew how to access urgent medical services immediately. He kept emergency contacts and insurance information accessible at home and on his phone for quick reference. In his workplace, he advocated for health promotion by organizing seminars and wellness activities, encouraging colleagues to participate in regular health screenings, physical activity groups, and mental health discussions. This initiative created a supportive environment and raised collective awareness of health issues. He learned the importance of balancing work deadlines with breaks, proper ergonomics to prevent repetitive strain injuries, and maintaining hydration during long work hours. As part of his ongoing health maintenance, he scheduled annual flu vaccinations and other age-appropriate vaccines, which he understood from his doctors and pharmacists as essential in preventing serious illnesses. He kept a personal calendar of vaccination dates and reminders for follow-up doses. Whenever traveling abroad, he consulted travel health clinics for recommended vaccines and advice about disease. Prevention relevant to the destination. This preparation ensured safety and peace of mind during trips. During medical consultations, he prepared questions in advance about test results, medication side effects, and lifestyle advice, promoting open and productive communication with his healthcare providers. This proactive engagement helped tailor treatment plans to his needs and preferences. He also maintained a personal health record system, either paper-based or digital, to organize medical history, laboratory results, medication lists, and appointment notes. This system facilitated better understanding and continuity of care, especially when consulting specialists. He valued the role of allied health professionals such as dietitians, physiotherapists, mental health counselors, and pharmacists, knowing that coordinated care from a team improves outcomes. In managing minor ailments at home, he used over-the-counter medications responsibly, following dosage instructions and checking expiration dates. He avoided self-medicating with unverified remedies and sought professional advice when symptoms persisted or worsened. Learning first aid was part of his health education. He completed a certified course that taught how to respond to common emergencies such as wounds, burns, choking, and CPR. This knowledge increased his confidence and readiness to assist family members or strangers in need. He ensured that his home had a well-stocked first aid kit, including bandages, antiseptics, fever reducers, and allergy medications, replacing used or expired items regularly. Regular eye exams were part of his health routine, with the optometrist checking vision, eye pressure, and signs of diseases like glaucoma or cataracts. Proper eyewear prescriptions and protective glasses for screen use prevented eye strain and maintained good vision. Proper hydration, nutrition, and breaks from screens also contributed to eye health. His sleeping environment was optimized for restful sleep. With comfortable bedding, minimal noise, and twice-daily exposure to natural light to maintain circadian rhythms. He avoided late-night screen time and caffeine consumption to promote better sleep quality. If occasional sleep difficulties arose, he tried relaxation routines rather than medications initially. He recognized the importance of social connections for emotional health and nurtured relationships with family, friends, and community groups. This social support system helped buffer stress and provided joy and meaning in daily life. His health insurance plan covered preventive care, chronic disease management, hospital stays, and prescription medications, reducing financial barriers to care. He stayed informed about changes in coverage and co-payments to plan expenses wisely. Overall, he learned that maintaining good health requires a proactive, multifaceted approach involving preventive care, lifestyle choices, mental well-being, and collaboration with healthcare professionals. Through persistence and education, he cultivated a rewarding sense of control over his health, setting an inspiring example for others. One bright spring morning, he woke up with a slight pain in his throat and a runny nose, classic symptoms of a common cold. Rather than ignore these early signs, he decided to monitor his symptoms closely and seek medical help if they worsened. He maintained his usual routine of drinking plenty of fluids, resting adequately, and eating nutritious foods to support his immune system. After 2 days, when the sore throat worsened and a mild fever developed, he contacted his doctor's office and secured an appointment for a physical examination. At the clinic, the doctor examined his throat, ears, and nose through an otoscope and checked his temperature and oxygen levels. To rule out bacterial infections like strep throat, the doctor performed a rapid antigen test, which came back negative. The doctor then reassured him that the symptoms were viral and recommended supportive care including rest, hydration, throat lozenges, and over-the-counter pain relievers. He was advised to watch for any signs of worsening such as difficulty swallowing, breathing problems, or persistent high fever, which would require urgent medical attention. Following this advice, he stayed home from work, limited contact with others to prevent spread, and took care to sneeze or cough into his elbow to reduce germ transmission. The pharmacist at the local pharmacy helped him choose the best symptomatic treatments and explained how to use them safely. With rest and proper care, his symptoms gradually subsided over a week. This experience reinforced his understanding of the body's natural healing abilities when supported by proper care and avoiding unnecessary antibiotic use. During follow-up calls, the doctor checked on his progress and reminded him about seasonal vaccination to reduce future illness risks. Staying prepared, he signed up for the annual flu shot as soon as it became available, ensuring protection against evolving flu strains. When someone in his family developed similar cold symptoms, he shared the knowledge about viral versus bacterial causes and advocated seeking medical advice rather than self-prescribing antibiotics. This conversation emphasized the importance of community health and responsible medication use. Another health concern emerged when he noticed unusual fatigue and frequent urination, prompting him to visit the doctor for a checkup. Blood tests were done to assess blood sugar levels, and the doctor explained the signs of diabetes and the importance of early diagnosis. Upon confirming elevated glucose readings, he discussed how type 2 diabetes could be managed effectively with lifestyle changes and medication if necessary. A diabetes educator provided support by teaching blood sugar monitoring, proper diet, and exercise plans tailored to his fitness level and preferences. He learned how to count carbohydrates, understand glycemic index values, and balance meals for stable blood sugar control. His daily routine included glucose checks before and after meals, noting the results in a journal shared with his healthcare team for ongoing adjustment. The doctor prescribed metformin as a first-line medication and explained the importance of adherence and watching for side effects like stomach upset. The pharmacist reinforced this guidance and illustrated how to take medicines with food to minimize discomfort. She also counseled on recognizing hypoglycemia signs and appropriate responses, such as carrying glucose tablets. Weight management became a crucial focus, with the nutritionist helping him set practical goals and introducing enjoyable physical activities, such as swimming and gardening. Stress reduction techniques were integrated since stress hormones can affect blood sugar regulation. Regular appointments with the healthcare team provided encouragement, addressed challenges, and reinforced positive habits. Routine eye exams included retinal checks for early diabetes-related changes, while kidney function tests were ordered to monitor for complications. This comprehensive care approach aimed to prevent long-term damage and maintain quality of life. Education about foot care and daily inspection was emphasized to avoid infections and wounds, common risk factors in diabetes. He invested in comfortable shoes and regularly cleaned his feet to reduce the chance of injury. Over time, his blood sugar levels improved, demonstrating the effectiveness of his sustained efforts. Increased energy and better mood encouraged him to stay motivated in managing his health. On the mental health front, he found support through counseling services offered by his health plan, helping him develop coping strategies for chronic condition-related stress. Mindfulness meditation and gradual exposure to new hobbies brought joy and mental clarity. He appreciated how mental well-being influenced physical health outcomes and prioritized regular mental health check-ins. Annual health screenings included cholesterol and blood pressure monitoring, with the doctor explaining how these factors affect cardiovascular risks, especially with diabetes. He adhered to a low-sodium, heart-healthy diet, keeping saturated fat intake to a minimum and focusing on whole foods rich in fiber and antioxidants. To stay active, he combined aerobic activities like brisk walking with resistance training to build muscle strength and support glucose metabolism. Instructions from the physical therapist ensured safe practices and addressed any joint discomfort. Participating in a diabetes support group connected him with peers facing similar challenges, exchanging tips and emotional support. This community involvement enhanced his motivation and sense of belonging. When minor infections occurred, he sought care promptly, understanding that delayed treatment in diabetes could lead to serious complications. Vaccinations against pneumonia and shingles were up to date, safeguarding him against preventable illnesses. He took precautions with foot hygiene and injury prevention to avoid infections requiring hospitalization. During travel, he planned medication schedules carefully, carrying extra supplies and checking cold chain requirements for insulin storage. Travel insurance was arranged to cover medical emergencies abroad, and he researched accessible medical facilities at his destination. Keeping emergency contact details and medical history on hand allowed for efficient care if needed. His personal health plan included a detailed medication list, emergency action plans, and dietary guidelines, which he shared with family and trusted friends. This preparation reduced anxiety around managing his condition in unexpected situations. He used technology such as smartphone apps to log health data, receive medication reminders, and communicate with healthcare providers between visits. This digital engagement facilitated timely intervention and strengthened his health management. Throughout his journey, he learned to balance acceptance of chronic health conditions with hopeful, proactive care strategies. His story reflected resilience and empowerment through education, adherence, and self-care. By practicing open communication with doctors, pharmacists, and support networks, he ensured comprehensive, tailored health support. This continual learning process became a cornerstone of his active lifestyle, guiding choices that promote well-being in body, mind, and social connections. He shared these lessons with family and friends, advocating for preventive health measures and responsible medical care in his community. The healthy habits developed extended beyond disease management to a joyful, balanced life enriched by relationships, physical activity, and mental wellness. This ongoing narrative of health and healing serves as a model for lifelong commitment to self-care and informed healthcare partnership. In the months that followed, he maintained his commitment to a healthy lifestyle and regular medical care, understanding that consistency was key to preventing illness and managing existing conditions effectively. On a routine checkup, the doctor recommended a series of vaccinations including the tetanus booster and a vaccine for hepatitis B, explaining their importance in adult preventive care. He scheduled the vaccinations with the local pharmacy, where the pharmacist provided detailed information about each vaccine, common side effects such as mild soreness or fever, and what to do in case of unexpected reactions. After receiving the vaccines, he monitored himself for a day or two, following the advice to rest if necessary and keep the injection sites clean. Continuing to learn about health, he attended community workshops on nutrition and exercise, where experts discussed how even small changes like incorporating more fiber, reducing added sugars, or scheduling short breaks for physical movement can substantially impact long-term health. Inspired by these talks, he incorporated new recipes featuring whole grains, legumes, and lean proteins into his meals and set reminders to stand and stretch every hour when working at his desk. His doctor tracked his progress through follow-up blood tests, monitoring cholesterol levels, blood sugar, and kidney function, all of which remained stable thanks to his dedication. On occasions when he felt mild headaches or muscle soreness, he self-managed with over-the-counter analgesics, carefully reading dosage labels and avoiding combinations that might cause side effects. If symptoms persisted more than a few days or accompanied other worrying signs like vision changes or weakness, he promptly sought professional evaluation. This cautious yet informed approach gave him confidence in recognizing when professional help was needed versus when at-home care sufficed. During a stressful project at work, he noticed increased insomnia and consulted his doctor about managing sleep difficulties. The doctor recommended cognitive behavioral therapy techniques for insomnia, CBTI, encouraging him to maintain a consistent bedtime routine, limit caffeine after mid-afternoon, and avoid screen time at least 1 hour before sleeping. Over several weeks, these adjustments helped regulate his sleep patterns without medication, and he felt more rested during the day. The doctor also suggested light evening walks and mindfulness meditation to reduce anxiety and prepare the body for restful sleep. He experimented with these methods, finding particular relief in guided relaxation recordings. As he embraced these health routines, he kept regular dental appointments, where his dentist recommended using an electric toothbrush and demonstrated proper flossing techniques to reduce plaque and maintain gum health. He learned about the link between periodontal disease and systemic conditions like diabetes and heart disease, reinforcing his motivation to maintain good oral hygiene. Nutritional advice from the dietitian emphasized eating crunchy fruits and vegetables that also promote dental cleaning. Throughout the year, he stayed aware of his mental health, recognizing that chronic stress could exacerbate physical health problems. His physician offered referrals to mental health specialists when he reported persistent low mood or anxiety, reinforcing that mental and physical health are deeply interconnected. He explored counseling, attending sessions that helped manage stress triggers and develop coping skills. This holistic care helped him maintain a resilient mindset during both health challenges and everyday pressures. When minor skin rashes occurred, he consulted the dermatologist who identified them as eczema, prescribing topical creams and lifestyle modifications to reduce triggers such as harsh soaps and extreme temperatures. He followed the advice, keeping the skin moisturized and avoiding irritants, which resulted in noticeable improvements. Seasonal allergies prompted the use of antihistamines during high pollen counts, and he learned to keep windows closed and shower after coming indoors to reduce symptoms. His proactive preparation minimized discomfort and improved daily functioning. During physical activities, he wore appropriate clothing and protective gear to prevent injuries and was careful to stay hydrated, especially during hot weather. Warm-up and cool-down periods became part of his exercise routine to reduce muscle strain. When an old knee injury flared up occasionally, he used prescribed anti-inflammatory gels and scheduled physiotherapy sessions, which focused on strengthening muscles around the joint and improving flexibility. The physiotherapist provided tailored exercises and ergonomic advice to prevent further injury. He appreciated the professional support that allowed him to stay active and pain-free. Over time, his understanding of health deepened, realizing it encompassed a balanced combination of medical care, self-treatment, lifestyle adjustment, and mental well-being. Regular communication with healthcare providers ensured treatments were personalized and responsive to his evolving needs. He became adept at preparing for medical visits by tracking symptoms, updating medication lists, and noting questions, which maximized appointment productivity. This proactive stance reinforced trust and collaboration with his health team. Encouraged by his own health journey, he shared insights with friends and family, promoting regular checkups, vaccinations, and healthy habits in his social circles. He became a role model for preventive care and patient empowerment. Travel for leisure was carefully planned to include health considerations such as carrying necessary medications, accessing local health services, and scheduling health appointments before and after trips. He researched destination-specific health risks and prevention strategies, ensuring safe and enjoyable travel experiences. Throughout, he remained an active participant in his community, engaging in wellness programs, volunteering for health awareness campaigns, and promoting supportive environments for healthy living. This multifaceted approach enriched his life and strengthened community health. His ongoing commitment to health reflected a philosophy of care and respect for the body's complexity, emphasizing prevention, early detection, lifestyle balance, and compassionate professional support. This narrative of health and doctor visits illustrates how knowledge, consistency, and partnership with healthcare teams empower individuals to maintain vitality and well-being throughout life stages. Over the following months, he regularly monitored his health with scheduled visits to his doctor and healthcare specialists to maintain optimal well-being. One morning, he began experiencing mild chest discomfort and unusual fatigue, prompting him to call his doctor for advice without delay. The doctor arranged a series of tests including an electrocardiogram, ECG, blood work to check cardiac enzymes, and a stress test to assess his heart function under controlled exercise conditions. The medical team explained each procedure carefully, easing his concerns and highlighting the importance of early detection in preventing serious heart problems. While awaiting results, he was advised to moderate physical activity, avoid stressful situations, and take prescribed medications such as low-dose aspirin and beta-blockers to support heart health. Following the tests, the doctor reviewed the findings and determined that he had early signs of coronary artery disease, which could be managed effectively through lifestyle changes and medication. He received detailed counseling about heart-healthy eating patterns, emphasizing the Mediterranean diet rich in olive oil, nuts, fruits, vegetables, lean proteins, and whole grains. The doctor recommended reducing salt, saturated fats, and processed foods while encouraging regular aerobic exercise tailored to his tolerance. He was connected with a cardiac rehabilitation program that provided supervised exercise sessions, education, and counseling to improve cardiovascular fitness safely. The program helped him understand his limits and progress systematically. Medications prescribed included statins to lower cholesterol levels, with clear instructions about adherence, side effects, and regular blood monitoring. The pharmacist reinforced these messages and advised on managing potential muscle aches and interactions with other medicines. He used a journal to track symptoms, medication schedules, and blood pressure readings, sharing updates with his healthcare providers for any necessary adjustments. Psychological support was incorporated since heart conditions can provoke anxiety. Counseling and relaxation techniques were introduced to manage stress effectively. This holistic care improved his physical condition and mental well-being, motivating him to continue positive changes confidently. He reduced smoking gradually, ultimately quitting with support from nicotine replacement therapy and behavioral counseling. His doctor applauded his progress and scheduled regular follow-ups to monitor heart function and overall health. Alongside cardiac care, he maintained vigilance over other health aspects including kidney function, liver health, and mental wellness through periodic tests and consultations. He participated in educational workshops about heart disease risk reduction, medication management, and lifestyle optimization to deepen his knowledge. At home, he made environmental adjustments to reduce heart strain, such as minimizing exposure to extreme temperatures and ensuring restful sleep. Sleep apnea screenings identified mild obstructive sleep apnea, for which the doctor recommended a continuous positive airway pressure (CPAP) machine. He adapted to its use, noticing significant improvement in daytime alertness and blood pressure control. Dietary changes continued with portion control and mindful eating, preventing overeating and promoting weight loss for heart protection. Swimming, walking, and light strength exercises became enjoyable parts of his routine. Receiving flu and pneumonia vaccines annually minimized respiratory infection risks that could exacerbate heart problems. Small lifestyle modifications such as reducing caffeine intake and avoiding heavy meals before sleep enhanced health. In addition, he remained cautious of symptoms signaling acute problems like severe chest pain, shortness of breath, dizziness, or unusual fatigue, knowing the urgency of medical care in such cases. Keeping emergency contact numbers and health insurance information readily accessible prepared him for unexpected situations. Beyond physical health, he continued nurturing social relationships and engaged in community volunteer opportunities that gave him purpose and joy. Mental health check-ins with psychologists encouraged resilience and coping strategies in facing chronic illness. Educational support groups provided camaraderie and practical advice from others with similar experiences. This comprehensive approach produced sustained health improvements and enhanced life quality. When traveling, he consulted travel medicine specialists, ensuring vaccinations and preventive measures were up to date and packed all necessary medicines securely. He limited travel during periods of high stress or illness and arranged medical facilities knowledge at destinations. Throughout his ongoing journey, he exercised self-awareness and proactive communication with healthcare providers, optimizing collaboration for best outcomes. He documented prescription changes, test results, and personal health goals in a digital system accessible on his phone. The privacy and security of data were important, and he followed best practices to protect his information. Annual physicals included screenings for cancers appropriate to his age and family history, including colonoscopy and skin examinations to detect any early signs. He stayed informed about emerging health guidelines and integrated evidence-based practices into his lifestyle. His evolving health narrative illustrated the balance of preventive medicine, lifestyle adaptation, patient empowerment, and professional care. By embracing this integrated approach, he maintained independence and vitality, promoting longevity and wellness. This long-term, balanced management of health challenges reflected a commitment to living fully and responsibly, inspiring those around him to value their own well-being. One autumn afternoon, while enjoying a walk in the park, he suddenly felt an uncomfortable tightness in his chest and mild shortness of breath, which led him to seek immediate medical care at the emergency room. The medical staff responded promptly, performing vital sign checks, oxygen saturation measurement, and an electrocardiogram to examine his heart rhythm and identify any signs of a heart attack. Blood tests were drawn to check cardiac enzymes, and a chest X-ray was performed to evaluate lung conditions. He was reassured that early assessment was crucial and that his prompt response likely prevented more severe complications. After stabilization, the cardiologist detailed the diagnosis of angina, a condition caused by reduced blood flow to the heart muscle, often triggered by physical exertion or stress. The treatment plan included medications like nitrates to relieve chest pain episodes, beta blockers to reduce heart workload, and aspirin to prevent blood clots. He received thorough instructions on recognizing angina symptoms and the importance of taking prescribed medications consistently to manage the condition effectively. He was advised to avoid strenuous activity until cleared by the cardiologist and to wear a medical alert bracelet stating his condition and current medications. Nutrition counseling emphasized heart-healthy foods with low saturated fat and cholesterol and rich in antioxidants like berries, leafy greens, and nuts. Smoking cessation support was provided, reinforcing how tobacco use could worsen his heart health. Stress management techniques including yoga, deep breathing, and mindfulness meditation became part of his daily routine to reduce angina frequency. Regular exercise resumed gradually under professional supervision, starting with gentle walking and light stretching and building endurance over months. Blood pressure and cholesterol levels were regularly monitored during follow-ups to optimize the treatment regimen. He learned to keep a symptom diary, recording the duration, intensity, and triggers of any chest pain to discuss during consultations, enabling the healthcare team to tailor interventions. His caregiver and family were educated on the signs of emergency, such as prolonged chest pain unrelieved by medication, dizziness, or loss of consciousness, and trained to seek immediate help in these situations. Pharmacists played a key role in counseling on medication adherence, potential interactions, and side effect management, ensuring safe medication use. He stayed informed about new medical treatments and lifestyle recommendations through credible patient education resources and support groups. Over time, his condition stabilized, and he gained confidence in managing his health by recognizing his body's signals and responding appropriately. He remained aware of the need for continued care and prevention to improve quality of life and reduce risks of cardiac events. Beyond heart health, he maintained regular checkups addressing other aspects including diabetes monitoring, kidney function, mental well-being, and immunizations. Symptoms like occasional dizziness or fatigue were communicated promptly during appointments to detect any secondary problems early. The healthcare team emphasized holistic care encompassing physical, emotional, and social health. Dental health was monitored closely, with frequent cleanings and daily proper oral hygiene to prevent infections that could exacerbate systemic conditions. Vision and hearing were assessed yearly to detect changes that could impact safety and quality of life. At home, he maintained a balanced diet, portion control, and hydration while avoiding excessive caffeine and alcohol intake. He prioritized sleep hygiene practices including consistent bedtime, darkened room, and avoiding electronics before sleep to promote restorative rest. Personal stress management strategies evolved, incorporating hobbies, social engagement, and mindfulness exercises to foster resilience. Community involvement in wellness programs, volunteering, and health education created a supportive environment for sustained healthy living. Travel plans included pre-travel health consultations, ensuring medication supply, vaccination updates, and researching local healthcare facilities. He prepared an easily accessible emergency health information folder and communicated plans with family. During illness episodes, he carefully assessed symptoms, initiating self-care or seeking timely medical evaluation as appropriate, minimizing complications. Health insurance facilitated access to medical services and medications, and he regularly reviewed plan benefits and coverage changes to avoid surprises. Digital tools supported medication management, appointment scheduling, and symptom tracking, increasing engagement and organization. He often prepared for medical visits by compiling symptom logs and questions, optimizing time with healthcare providers. Education on recognizing critical symptoms, appropriate first aid, and when to seek emergency care empowered him to act decisively in urgent situations. He kept his home environment safe, organized first aid supplies, and maintained clean surroundings to reduce injury and infection risks. He maintained active communication with his medical team, resulting in high-quality, personalized care, early intervention, and adaptive treatment plans. He cultivated a perspective that health is an evolving balance requiring lifestyle adjustments, routine care, and mental health attention. His journey highlighted the interconnectedness of physical symptoms, emotional well-being, social support, and informed healthcare access. Through perseverance, knowledge, and cooperation with health professionals, he maintained health stability, improved well-being, and prevented complications. His story serves as a comprehensive model for managing symptoms, doctor visits, medication adherence, lifestyle changes, and ongoing health maintenance for learners seeking to improve their English while gaining useful practical knowledge. He soon became more familiar with managing minor illnesses at home, like seasonal allergies that caused sneezing and itchy eyes in the spring, knowing when to use antihistamines and when to visit a doctor if symptoms worsened or became chronic. He kept a handy list of common symptoms, such as headaches, stomach troubles, or rashes, which helped him describe his condition accurately during medical visits, making diagnosis easier. When cold weather arrived, he was careful to dress warmly and avoid sudden temperature changes to prevent respiratory infections. After noticing occasional shortness of breath during exercise, he consulted his doctor, who ordered lung function tests and ruled out conditions like asthma or chronic bronchitis. He was reassured but advised to avoid allergens and pollutants and to keep up with regular aerobic exercise to strengthen lung capacity. His family doctor also reminded him to maintain up-to-date vaccinations, including the annual flu shot and pneumococcal vaccine to protect respiratory health. He adopted healthy sleep habits, such as a fixed bedtime schedule and avoiding heavy meals before sleeping, which improved his daily energy and mood. Hydration was essential, so he made sure to drink water regularly throughout the day, especially during physical activities. Stress management became a part of his lifestyle as well, with practices like meditation, deep breathing exercises, and engaging in hobbies that brought joy and relaxation. When he experienced minor injuries like cuts or bruises, he cleaned wounds promptly and used antiseptic creams as instructed by the pharmacist, reducing infection risks. He understood the importance of hand hygiene and regularly washed hands, especially before eating or after returning from public places. Checking the expiration dates on medications and avoiding sharing medicines with others were rules he carefully followed. During visits to the doctor for annual checkups, he underwent blood tests to monitor cholesterol and blood sugar levels, which helped detect early warning signs of conditions like diabetes or heart disease. The doctors highlighted the importance of a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, while limiting processed sugars and unhealthy fats. Participating in regular physical activity, such as walking, cycling, or swimming, was encouraged to maintain cardiovascular health and control weight. The doctor explained how maintaining a healthy weight reduced the risk of developing chronic conditions and improved overall quality of life. When prescription medications were necessary, he diligently followed the dosage instructions, never skipping doses and informing the doctor of any side effects like nausea or dizziness. Pharmacy staff supported him by reviewing his medicines and advising on interactions or best times to take pills with or without food. Immunizations were maintained according to the recommended schedules, including tetanus boosters and vaccines for preventable diseases like shingles, ensuring long-term protection. He kept health insurance details organized and knew how to use coverage benefits for medications, specialist visits, or emergency care. When traveling abroad, he researched health facilities at his destination, packed necessary medications, and carried copies of his medical records to facilitate care if needed. He recognized the importance of mental health, seeking counseling and support when feeling overwhelmed or anxious, and utilizing community health resources and helplines. His doctors and counselors emphasized mental well-being as a pillar of overall health, encouraging communication and resilience-building strategies. He understood the risks of smoking and alcohol overuse, avoided them to protect his heart, lungs, and liver, and encouraged friends and family to do the same. Regular dental checkups ensured oral health, with dentists advising proper brushing, flossing, and lifestyle choices to prevent cavities and gum disease, which could affect general health. Eye exams helped him maintain clear vision. When necessary, he used corrective lenses and practiced eye rest during long computer work. In moments of illness like colds or mild infections, he followed medical advice for symptom relief, stayed hydrated, rested sufficiently, and sought professional care if conditions worsened or lasted longer than expected. Emergency awareness was vital. He memorized symptoms such as chest pain, severe breathing difficulty, sudden weakness, or confusion, which require immediate medical attention. His home was equipped with a first aid kit containing bandages, antiseptics, pain relief, and allergy medicines, kept stocked and accessible. He remained proactive in learning about personal health, reading educational material recommended by health professionals and attending public health talks. This knowledge empowered him to make informed decisions about his lifestyle, medications, and when to seek medical help. He valued preventive care and early diagnosis as keys to avoiding complications and ensuring a longer, healthier life. Through this comprehensive approach, covering symptoms, appointments, medicines, advice, lifestyle, and follow-up care, he built a strong foundation for lifelong wellness that inspires those around him. As the seasons changed, he remained diligent about his health. One chilly morning, he experienced a sudden bout of headache and mild dizziness. Concerned, he made an appointment with his doctor to discuss the symptoms and rule out any serious issues. During the visit, the doctor asked detailed questions about his headache's frequency, intensity, duration, and any associated symptoms such as nausea or vision changes. The doctor examined his blood pressure, which was slightly elevated at that moment, and recommended a series of tests including blood work to check for anemia, blood sugar levels, and thyroid function. The doctor advised him to monitor his headaches in a diary, noting potential triggers such as certain foods, lack of sleep, or stress. Meanwhile, the doctor suggested lifestyle changes, reducing caffeine intake, improving hydration, managing stress through relaxation exercises, and maintaining a consistent sleep schedule. He took the advice seriously, setting reminders to drink water and practicing simple stretches and deep breaths during work breaks. The blood test results came back normal, but his doctor emphasized managing his blood pressure through diet and exercise to reduce future health risks. He was encouraged to lose a few pounds to help lower blood pressure naturally. The doctor explained the DASH diet, which involves eating plenty of fruits, vegetables, lean proteins, and whole grains while reducing salt and saturated fats, and suggested joining a community walking group for social exercise. He felt motivated by the idea and soon joined weekly walks with neighbors, enjoying both the physical activity and social interaction, which made the habit enjoyable and sustainable. The doctor also recommended avoiding alcohol or limiting to 1 drink a day, as excessive alcohol can raise blood pressure. He tracked his blood pressure readings at home with a digital monitor, logging the results to discuss during follow-up visits. Over time, consistent healthy eating and physical activity improved his blood pressure and reduced the frequency of headaches. On occasion, if a headache struck, he tried over-the-counter pain relievers as recommended, carefully reading dosage instructions and avoiding taking medication on an empty stomach. The pharmacist advised him about potential interactions with other medicines and side effects, reinforcing safe use. During routine checkups, the doctor checked his vision, ensuring no changes requiring new glasses. They discussed eye health tips, such as taking screen breaks every 20 minutes to reduce strain and wearing sunglasses to protect against UV rays. The doctor also reminded him about regular dental visits to maintain oral health, which can impact overall body health. The dentist praised his consistent oral hygiene, reminding him to floss daily and avoid sugary snacks that encourage cavities. He booked annual dental cleanings and had minor cavities treated promptly to prevent worsening. When a friend mentioned symptoms of seasonal depression, he researched and discussed with his doctor, learning about the impact of daylight changes on mood. The doctor suggested increasing outdoor time during sunny days, light exercise to boost endorphins, and mindful breathing techniques for emotional balance. If mood problems intensified, counseling or therapy could be beneficial, the doctor reassured. He integrated morning walks and hobbies like reading and music, which uplifted his spirits. During the peak of cold and flu season, he stayed vigilant about symptoms such as fever, chills, coughs, and sore throats. Early symptoms prompted rest at home, increased fluid intake, and use of over-the-counter remedies for relief. The pharmacist advised him on when to see a doctor, such as if fever lasted over 3 days or breathing became difficult. He got the annual flu vaccine at the pharmacy, which his doctor recommended as vital prevention. During one episode of persistent sore throat and fever, he saw the doctor, who tested for strep throat and prescribed antibiotics after positive confirmation, emphasizing completing the full course. He took the medication responsibly with meals to minimize side effects and monitored the response. He also learned the importance of covering coughs, washing hands frequently, and avoiding close contact with others to reduce contagion. On a different occasion, he experienced stomach upset after eating and consulted the doctor, who suggested an ultrasound to check for gallbladder issues. The test showed mild inflammation. Dietary adjustments were recommended to avoid fatty or fried foods that worsened symptoms. He switched to light, nutritious meals, eating smaller portions and avoiding late-night dinners. The doctor prescribed antacids to manage discomfort and encouraged hydration and probiotic-rich foods like yogurt for gut health. With these changes, his digestion improved significantly. Recognizing the importance of preventive screenings, he followed doctor recommendations for age-appropriate tests such as colonoscopy, blood sugar screening, and bone density checks. Early detection of any abnormalities enabled timely intervention and better prognosis. When prescribed new medications, he consulted both doctor and pharmacist to understand indications, dosages, and possible side effects, resolving doubts before starting treatment. He kept an updated medication list, including supplements and over-the-counter drugs, which he shared with healthcare providers to avoid harmful interactions. The pharmacist offered advice on managing medication costs with insurance and generic alternatives. As part of holistic wellness, he incorporated mindfulness and relaxation practices daily, helping reduce stress hormone levels and promoting cardiovascular health. He also avoided smoking and secondhand smoke exposure, understanding the extensive damage tobacco causes across multiple organ systems. Alcohol use was moderate and occasional, aligned with medical advice to reduce disease risks. Community health resources provided support interactive workshops on diet, exercise, and chronic disease management, which he attended regularly to gain knowledge and motivation. He fostered social connections through volunteer activities and health groups, which enhanced emotional well-being. He became adept at recognizing warning signs that necessitate emergency care, such as severe chest pain, sudden weakness, difficulty breathing, or altered consciousness, always prepared to act quickly in crises. Travel health checks ensured necessary vaccines and medications were in place when visiting different regions. Medical records and insurance information were digitized and accessible on his phone for ease of communication with health providers. He valued collaboration with his healthcare team, fostering open communication, asking questions, and following advice closely. This partnership empowered him in managing his health journey successfully and sustainably. Thank you so much to everyone for joining me on this journey to improve your English through practical and useful health-related conversations. Remember, every small step you take toward learning brings you closer to your goals, so keep practicing, stay curious, and never give up. If you found this helpful and want to continue progressing, please subscribe to my channel, Progressive English Learning. Don't forget to hit the bell icon so you never miss a lesson. Also, please like, share, and comment to support the channel and help others join our learning community. Your progress is our motivation.